Good morning, doctor.
Yes, good morning.
I hope you're doing great.
Yes, it's absolutely great. Thanks.
Thank you so much, doctor. First thing, thank you for using Nidan AI. And
Yeah.
we would love to know what is your feedback on Nidan AI and how do you use it? Where do you use it? There are a lot of questions, so
Okay,
please
okay.
feel free.
So it is wonderful connecting with you and wanting to share this feedback. So I'm Dr. Abhay Talwalkar and I've been practicing homeopathy and holistic health for the past 30 years in rural India, actually, in rural Maharashtra. So
Okay.
as a doctor working closely with rural communities, Nidan AI has truly been a breakthrough tool in my practice. The ability to scan a patient's face and instantly access over 25 health parameters. That's something really great. These parameters like HRV or blood pressure, oxygen saturation, stress levels, cardiac workload, all of this just with a scan, it's nothing short of revolutionary. So, this has really revolutionized the way I've started investigating patients. And the most important thing that I appreciate is how accessible and non-invasive this thing is. You don't need to use any needles, no wires, no waiting in the lab for drawing the blood and waiting for the lab reports. Just a quick face scan, and then you have a comprehensive snapshot of your patient's physiological state. So, especially in rural settings where diagnostic infrastructure is often limited, this technology I think has helped me screen a lot of patients early and prioritize the healthcare and monitor chronic conditions very, very effectively. So, Nidan AI bridges the gap between advanced diagnostics and grassroots level healthcare. And I think it's really very smart and it makes preventive healthcare available at doorstep. So I highly recommend this for every practitioner working in low resource environment or high volume environments where the resources are limited. I think this is a revolutionary concept. I'm really happy with this. Thank you.
I would like to know how do your patients, like since you mentioned that you are in the rural area of Maharashtra, so how do your patients react to such technology?
Yeah, they are fascinated to begin with. Just they feel that what am I trying to do? Just take a photograph or whatever it is. But they are fascinated that at the end of it, you get the idea of all these parameters in them, and they really don't have to go anywhere. And just sitting in front of me or sitting in the clinic, we can do this. So it's a very fascinating experience for them. It is cost saving as well for them. And as I said, we don't have to wait for all the reports, and uh, that's something which is very, very unique about this concept of Nidan AI.
Interesting, doctor. So, doctor, what kind of doctors or you recommend this to use?
Yes, so apart from the general practitioners, okay, who will really benefit from this, I think even the advanced practitioners, people like, the physicians, MD physicians, or specifically endocrinologists, they can also really benefit from this. Because as I said, it's really very easy. It's a matter of few seconds that you scan the face and you get these 25 parameters in front of you. So I think
True.
these kind of people, and mainly, as I said, general practitioners in remote areas, it's an asset to have Nidan AI, because for them it's really difficult at times to get hold of the laboratory and get hold of the lab technician and do the all the tests.
Makes sense, doctor. Makes sense. Thank you so
Yeah.
much, doctor. Wonderful, doctor. And also, just to add on, do you think that doctors can have a monetary gain with this as well?
Monetary gain, yes, of course they can have, because again, as I'm saying again and again, repeating myself, that there are 25 parameters which you are monitoring in a
Correct.
simple scan. So basically, if you would put the cost for all these parameters actually to be done and the time spent in that, I'm sure that this will work out monetarily as well for doctors.
Wonderful. Wonderful, doctor. Doctor, I think I've asked you all my questions. Thank you again for all the time that you have given us. And if you would like to add anything, I would be more than happy to hear you.
As of now, I think I've said whatever I wanted to say. Thank you very much for inviting me and allowing me to share this experience with you. Thank you and all the best.
Thank you, Doctor. I appreciate it.